Hi everyone, thank you for joining us tonight. Really appreciate you being here. We've got a really interesting webinar planned for you, which I hope you really enjoy. So I'm Jackie, I'm a health coach and physiotherapist at Lotus Holistic Medicine. And tonight we've got our guest speaker, Dr. Nia Rajan, who is also working at Lotus Holistic Medicine. So just briefly a little bit about Dr. Sunil. So he initially trained in general surgery before moving to the UK. He achieved a fellowship of the Royal College of Surgeons of Edinburgh and trained in cardiothoracic surgery at renowned institutions, including John Radcliffe Hospital and Papworth Hospital. Transitioning to general practice, Dr. Rajan became a member of the Royal College of General Practitioners, and in 2010, he relocated to Australia. He now has a growing interest in mindset work, which led him to study further on the work of the mind and become a master NLP practitioner, trainer, master hypnotherapist. I'm sure Dr. Sunil will tell us a little bit more about his story and how he came to be working in this area now, and I'm really looking forward to it. So welcome, Dr. Sunil.
Hi, so am I on the full screen now?
Yes, yeah, you are.
Hello. Thank you very much, Jackie, for that introduction. And welcome, everyone. I can't see you all, so I hope everybody's over there. Before I start, I would like to acknowledge the traditional land of Gabi, where I am, and pay respects to elders, past, present, and emerging. And also would like to respect and pay respect to all the giants of the medical and psychological psychiatry, all the researchers on whose work, what the work I'm doing is. So most of what I'm doing is nothing original. It is mostly my own interpretation, but all the work has been done by really hardworking, innovative, clever people. Shall I just share slides and check?
Yeah, sounds good.
Okay, can you see the slides?
Yeah, if you can just make them full screen, that would be great. If anyone has any questions throughout, feel free to pop them in the Q&A box, and we'll probably get to them at the end. If we can during the presentation, we might do that as well.
So hypnotherapy. So whenever we say hypnotherapy, the usual questions I get is a bit of a funny look, and most people then say, would I cluck like a chicken? And I don't know, this is everybody's concept of hypnotherapy has unfortunately been hijacked by stage and hypnosis shows, which, although it has got great entertainment value, unfortunately demeans and devalues the clinical work that can be done via hypnotherapy. So I want to clarify that and probably help you understand a little bit more in depth about how hypnotherapy can work. And of course, then how it can be used in our clinical settings in helping people heal from their various emotional states. The question is, are emotional blocks holding you back? And interestingly, what are emotional blocks and how does it manifest? And often people come to us as a GP. I see a lot of people coming with either frankly obvious anxiety. They are aware that they become anxious whenever they're planning something, going out with friends or taking an interview. And of course, a lot of people have multiple physical ailments like chronic pains, abdominal pains, migraines, where people have been to numerous specialists. In fact, this is how my journey into the mind started. There was a time when I was training in surgery. And as a surgeon, of course, it is very easy to find a solution. It's mostly we are focused on curing a problem. So if we have a tumor or something, we excise it and that's it. But when I transitioned to a general practice, I noticed that a lot of people were not getting cured. They were just coming for repeat prescriptions for medications for essentially what were lifestyle problems, blood pressure, overweight, smoking. And what made me really think a bit more deeper into this was the fact that people actually knew that what they were doing was not in their best interest as far as health was concerned. Pretty much everybody who had a heart attack, who was continuing to smoke, knew that it was dangerous for them. Yet they were somewhat helpless. And all they knew was, I want to quit, but I can't. So I started looking at what is a problem and gradually knew that it is a communication as GPs, as doctors, as healthcare professionals. Most of us were able to somehow not communicate well the importance of this. This is what my initial thoughts. But it's only later on I realized that actually the problem was further much deeper. In fact, one of my patients actually came and told me that he actually quit cigarettes after seeing a hypnotherapist. This was when I was a registrar in the UK in general practice. And that was my first time when I heard about, until that time I had heard about Mesmer and somewhat about stage shows actually, just like everybody else. And I got curious. I got the name from that patient about this hypnotherapist. I actually rang her and asked a few questions, and that started my curiosity. But the problem was when I spoke to this about to my GP trainer, he laughed at me and laughed at this, and then sort of looked at me in a funny way and said, "You're not going to the other side, are you?" And I just felt really embarrassed, and I just dropped the topic from then onwards. But that seed had been planted, and it stayed in my mind. And whenever this kind of difficult behaviors were resurfacing, I had this thought, oh, maybe I should send them to this. But I was afraid that my peers might look down upon this, and it was not considered as really scientific. Anyways, I had this open mind about wanting to explore this down the line. So what is hypnotherapy? It is a way of connecting with our deeper self, the subconscious mind, or some people call the unconscious mind. And it's a very effective therapy for the mind-body connection. It actually utilizes the natural state of hypnosis. We go into trance every day. I'm sure you probably realize that some days you drive from home to work, and all the way you reach work and don't even realize how you reach there, as in you just negotiate all the traffic lights and everything, and bam, you were there. So that's actually a trance. And automatic behaviors. A lot of people, especially most women who are raising children, you can relate to this. You're answering the phone, and then at the same time, the baby is crying. You're probably pouring something soother in the baby's mouth, even changing nappies, and all kind of stuff. That is automatic behavior. So there is a evolutionary benefit in having automatic behavior. But unfortunately, if their automatic behaviors are of negative consequences, then they have definitely a detrimental effect on our life. So basically, hypnotherapy accesses that subconscious mind where our automatic behavior patterns, whether they are good or bad, are existing, and we can harness that to move forward in a more effective way. So we use our ability to have focused attention and do some deep relaxation. And then at that moment, we are connecting to our deep subconscious mind, and we have heightened suggestibility. And essentially, most people think that they will lose mind control and all that. Actually, that is not true. They are actually in control of their mind all the time. And an ethical practitioner will always ask the client whether it is okay or what changes would you like to happen. It's only if the covert hypnotherapists or stage hypnotists will do things that is mainly for entertainment value. And of course, they are not likely to do any harmful things most of the time. So it may be worthwhile knowing what hypnotherapy isn't. It certainly isn't mind control. People sometimes think that they will go into a deep sleep, which is also not true. You can actually have a trance sitting there, and in trance having a little bit of a conversation with you, yet be fully in trance. Now, some people say, I cannot be hypnotized. Really speaking, actually, there's nobody who cannot be hypnotized. If you've ever been driving from one place to another and have been in trance and suddenly found yourself at your destination, most likely you were in trance, and therefore you can be hypnotized. Now, in terms of hypnotherapy, it is actually a very safe practice. There is a structure to that. And the structure is and the hypnotherapist, a trained hypnotherapist, knows how to get you safely from one part of the whole trip to the other part. So how it works? How does it work? So most people are aware there's a conscious mind, which is what we are thinking or consciously being aware of. And then, of course, there is the subconscious mind. And the commonest analogy that we use is the iceberg, as the bottom of the iceberg is actually much, much bigger and deeper, and all is a proverbial tip of the iceberg. The conscious mind is the equivalent to that tip of the iceberg. And the unconscious mind is the one, or subconscious mind is the one that is deeper under the surface. And actually, most people say about 95% of the mind is actually governed, or our behaviors are governed by the subconscious mind. So the conscious mind is the one that is from the prefrontal cortex at the brain. And it will consciously think. For example, if you were starting a new program, you consciously engage into that. For example, driving. When you started driving, you had to remember, especially if it was a manual car, you had to remember to engage the clutch, change the lever gear, and so on and so forth. But afterwards, it becomes automatic behavior. That's when the knowledge is pushed down the subconscious mind so that it frees up the conscious mind for doing other work to be safe and secure and all. So in the hypnotherapy, we actually bypass the critical faculty of the conscious mind so that we can access the subconscious mind. And that's where most of our beliefs, old habits, and emotions are parked. And therefore, when we access that, we can actually then do the therapeutic alteration or change that we need to do. We use guided imagery and suggestions and some therapeutic dialogues to help achieve that result. So we use what we call progressive relaxation. Then there are several deepening techniques to get into, if you want to go into very deep trance for sometimes some certain aspects. And then we introduce the positive suggestions to introduce the change work. And at that time, we can help them visualize their goals as well as reframing or seeing things from different perspectives. And then we often use a technique called anchoring. We can hold that and store that in a somatic way in the body and achieve that result. How can we use or where can we use it? In fact, actually, there is not a single situation in medicine where we cannot use hypnotherapy. What I mean is not for something that has happened suddenly, like tonsillitis or anything like that, but anything that is long-standing, which is in medical terms chronic. In our day-to-day parlance, often we use the word chronic to indicate severe, but in medical language, chronic means long-standing. So if somebody has got long-standing abdominal pain, which has been investigated by lots and lots of modalities, and we still can't get to the root of that problem, often there is a subconscious hook, a hook which is hiding in the subconscious mind. And those kind of things can be can be accessed via hypnotherapy. Anxiety, stress management, depression. If people have phobias and like phobias of spiders or phobias of dogs, all kind of phobias of flying, all can be handled very well with hypnotherapy, especially using NLP models. People struggling to sleep, which is a common problem nowadays. Although sometimes people are not sleeping at the right time and using too much technology and all that. However, sometimes lack of sleep is a deeper problem. And then, of course, healing from trauma is something that is very useful in hypnotherapy because the mind is more relaxed, more accepting to the change work. I'll come back to that trauma bit in a bit later. To bring in behavior changes, again, hypnotherapy is very useful. Smoking cessation, any form of addiction to screens, addiction to food, chocolate, you name it. Weight loss and emotional eating. Often people have a disconnect and their eating patterns are different, not helpful eating patterns. And that also is a very useful tool. By hypnotherapy is a useful tool for that. Confidence and performance enhancement. For example, people going for interviews, they are good candidates, but often if they are fumbling at the interview, they give a very bad impression. Often that is fear-based, and it could relate to some childhood belief system that they have. Very good to see somebody who can easily help you with that. Other thing is chronic pain, long-standing pain, because our body is essentially designed to heal. We have a cut. If you don't do anything, it is bound to heal. It is unless you have if you have reason to have infection like bugs coming there or just the wound has been kept dirty or whatever. As a general rule, we are bound to heal. But if you are not healing, then the question has to be asked, why? And for example, if somebody had a fall from a height, fractured a vertebra, he was 25 or 20 in that young age group, in 6 to 12 months, the fracture should have healed well. But if they're still in pain, like 10 years later, something deeper is at play here. And that is why if you have that kind of situation, hypnotherapy can be a very good tool to actually interrogate that subconscious mind and find the real cause. And this is literally sometimes is like switching off of a switch. Other conditions like irritable bowel syndrome, tension headaches, migraines, skin conditions. Interestingly, a lot of skin conditions where stress, immune-mediated conditions like psoriasis and all those things can be really helped by hypnotherapy. Other chronic, Dr. Sandeep is very much seeing a lot of patients in the Lotus Clinic for mold and chronic tick bite fever and like chronic tick disease later on. And often there is the illness has come, but they actually have an exaggerated response to many of those, the agents. And again, hypnotherapy can be a valid tool to interrogate again the subconscious mind if there is something being held. In fact, now in a little while, I'll be talking about the body, physical body holding on to trauma, and I'll explain that in more detail at that time. Just to get an idea about why we do certain things in a way, just to understand our subconscious mind, I just would like to just show you what is called as Maslow's hierarchy of needs. Abraham Maslow was a psychologist in America in the 1930s. So his observation led him to come up with this triangle. So at the bottom, there are some basic needs. These are physiological needs, which is food, water, warmth, and then security and safety. And then, interestingly, only one, we have to actually meet each stage to walk up the pyramid. And right at the top is self-actualization. Self-actualization could be somebody wanting to become more spiritual or maybe do more charity work to the community, giving more. It's something above oneself. That's what self-actualization means. But people can't get there unless they have met. See, because our subconscious mind or actual needs, each of these needs met before we can move up the ladder. So sometimes physiological needs are actually met for most people. When the baby is born, very helpless, but parents look after the food, water, warmth, and all those things. But often there would be issues with security and safety. If the parents are not in a stable environment, they're not living in a secure place, or if they are, for various reasons of war, emergencies and all that, if they're having to move constantly, then the safety needs are not met. And interestingly, even though the parents may be in all other ways looking after the child very well, if the emotional trauma is happening to the baby because of the insecurity, which the parents unknowingly are projecting, not verbally or knowingly, that can lead a gap in their development, which sometimes can lead to hidden fears. Now, I see this quite often when people go into the trance. When they come out, they actually figure out that this is what happened. And I hear stories about when babies' memory, the children's memory, sometimes you don't think they remember things from an age of 1 or 2, but it's quite often we see that they actually remember these things. It is important to understand that each need has to be met. And when they are not met, often it ends up being a problem later on in the form of held trauma, like an emotional trauma. So undetected trauma is probably one of the fundamental causes of chronic illnesses we see in practice. People presenting with various illnesses, including abdominal pains, migraines, even mold-related illnesses, their response to that is mold. Even after being treated or being with different treatment modalities, they still are not getting the full benefit out of that. And here I would like to just bring to your attention a lot of work has gone in this area now, especially with the advent of functional MRI scans. People have been able to study the brain, how the trauma can actually rewire our brain, and certain areas of our brain are actually poorly developed. So the question is then, can they actually heal fully so that those areas can rewire? The answer is yes. The big work has been done in the neuroplasticity. Maybe even about 40 years ago, the thought was once the brain development is complete, we do not move, then it is not possible to do any changes. But current research contradicts that. And the neuroplasticity is very helpful and good to understand that because of neuroplasticity, we can actually do very well. I just want to quote, I have been very heavily influenced by few doctors, and Dr. Bessel van der Kolk is a psychiatrist in America, and he actually noticed that a lot of people coming to him for pain relief and other things actually had a trauma background. And he noticed that trauma actually, and then he came in the book, he states, because a lot of research in that, many years of studying lots and lots of people, and he says trauma actually lives in the body, and it presents as various pains. And then including because of trauma, it actually the brain structure itself alters. He was I think the earliest ones to come up with that. But he said it's about safety. So once the healing is possible, once people start to feel safe and appreciate that, and once they start to feel safe, they can actually lead to thrive again. But it's a journey. Although this model of the brain function is a little bit outdated, but it's a good way to understand. For the area that has been the green, the amygdala, is our antennae for detecting threat. And when we have an unsafe environment, the amygdala becomes hyper alert. And then what happens is the forebrain, which is the front of the brain, which is the new part of the brain in terms of evolution, that brain it gets hijacked, so to speak. So even though as a child you were growing, and when you're growing, you saw a dog and you froze because you saw somebody being attacked by a dog, and now you are a 25-year-old, an adult, well-built, and you're not that dog. Most of the dogs are, especially if they're on a leash, they won't hurt you. Yet, if you see the dogs, momentarily you just freeze. And that's because the amygdala has suddenly the antenna has just gone up and all the defenses have been put in place. So just an understanding of that helps, because there are ways to help calm the amygdala down and help with the chemical rewiring of the brain. Another very important work is Dr. Gabor Mate, a Canadian GP who was working with drug addiction in Vancouver, downtown Vancouver. And he was just seeing a lot of people with significantly affected, again, aware that the heroin they were injecting was going to potentially kill them. Yet, for that momently the pain, to escape the pain, they were still using it. And he came up with some very pithy statements that trauma is not what happens to you, it is what happens inside. And the common understanding he and Dr. Bessel van der Kolk had was this: at the core of trauma, there's a disconnection from the body and the emotions, and they lose authenticity. People are fearful, they cannot trust people, and they cannot even relate to normal situations as normally most people who have not been exposed to such trauma would do. Unresolved trauma can lead to chronic illnesses, addiction, and mental health struggles. And this is, again, Dr. Gabor Mate's work is very much in that realm. And he has got a way of healing. He uses what's called as compassionate inquiry and connection. And by the way, I forgot to mention, Dr. Bessel van der Kolk's work is, he uses and likes to, because the body is somatic, obviously, the healing can be with somatic therapy, which is movement, dance, and there are various ways of healing the body by doing that. I've raced through this because I just wanted to give an overview of this, because it's a huge amount of work that has gone in there. I just want to share a couple of patients just so that I could just try to give a flavor of what happened. I have a lady she's 54 now. She had been in pain for years and body pain, various places, currently unemployed, unemployed for the past 14, 15 years. Always in pain, she said, seen about nearly 20 different specialists in various places and had numerous investigations, numerous scans, couldn't find that, and had been on various opioids and a lot of medications, self-medicating with marijuana and everything. So it took a while for her to even have rapport, to have a conversation about the pain, and entertain the thought that this pain that she was feeling could be other than a physical, something that we could find. Interestingly, she was a youngest of 7 or 8 children. Parents were alcoholics, so she said, I raised myself. That's her words. And she had significant difficulty with food, because being the youngest, whatever food was available, unfortunately, the older siblings would be on the prowl, whoever gets hold of it. So she had to eat very quickly. Otherwise, her older siblings would snatch the food from her. So she actually had such a thing about food. And so once she had that glimpse of that in hypnosis, she found this. She actually had a better relationship with food. And interestingly, once she understood this, somehow, I think she wanted to, within a single session of hypnotherapy, and she had this amazing switch in her behavior. And now 2 years on, she is not in pain, on any pain medication rather, and her relationship with her food has changed. She has lost a bit of weight, and she's enjoying life better. I wrote the colorful dress there just to remind me. Interestingly, for the first 2-3 years when I saw her, she was always wearing a black dress and comes to the surgery. And after the hypnotherapy session, when she came in and she was wearing a very colorful dress. And I could not take notice and ask her. And she said, "Oh, I forget the exact words she said. But anyway, she was joyful inside. So it is a shift. And this is amazing to see that. Yeah, I got another example of a gentleman, 52, successful person, very successful public figure, but severe stress. And in the networking events and all that he was going, there was a lot of alcohol involved, and he was very much drinking until his liver was quite unhappy. And he was taking quite a lot of tablets to help him sleep along with his alcohol. Then he got into some kind of financial troubles and was in and out of court. Anyway, and unfortunately, he was a victim of sexual abuse from at a young age. So all this had kept him in that loop of pain, and alcohol was a welcome relief for him. Actually, he was hiding behind alcohol, he said to me. Anyway, so once he understood that there could be his alcohol behavior is related to his trauma, he was willing to engage and work. And after a couple of sessions, he actually is now, I haven't seen him for just about 12 months ago. 12 months on, he's free of alcohol, and he's back at work and actually not on any medications to help him sleep. The work. But having said that, these are exceptions, like 1 or 2 sessions. Often with deeper trauma, often they need more sessions. So in summary, hypnotherapy is natural because we actually go into trance quite often. It is safe. And once you do the work, it's actually quite empowering. You're back in control of your behaviors. It actually works on the root causes, not just symptoms. I have actually not mentioned, hypnotherapy in itself is not therapeutic. We use wide modalities, a variety of modalities. We use NLP. There is timeline therapy, and I use a technique called matrix therapy, which has been from a wonderful lady in Sydney called Pip Mackay, who has developed that takes Jungian archetypes as well as some Greek mythology, NLP and timeline, and she has blended into an amazing program, which actually helps people to heal from the inner child that has been hurt, that did not feel safe, starts feeling better. We can use all those modalities, and the hypnotherapy it's a switch to access the subconscious mind. So we use the NLP modalities to actually go that travel in rapid travel towards healing. Obviously, it is not a standalone treatment. I do not advocate that people just abandon every other treatment. Inside being a holistic GP, I feel that there is a role for medications as much as mind. But the more empowered we are, the less we need to rely on medications. So, how health changes. And I firmly believe, and it has been proven by other researchers, that we have an innate intelligence in our body. This is very, very poorly recognized. I suppose maybe the pharmaceutical industry and everybody probably doesn't want this to be very much recognized, or people are not wanting to work because it involves a little bit of work and find that little confidence in our own body. I just will illustrate with a little example, actually. For example, somebody say if you have left a little bit of food, cooked food in your fridge on a Friday and you have decided to go away. And unbeknown to you, for example, if there was a power outage or something and the fridge was not working for a short period of time, and if you come back on Sunday evening and then reheat the food and eat it, most people, if the food was starting to go off, most people sense something. The taste is not the right thing, most people will abandon. But just in case you did not abandon it and did not think about it and were unaware of the fridge having that power outage, and you continue to eat it, most likely within an hour or so, you will vomit. And even if that didn't happen, if the food transition through the stomach and then further down, most likely you will have diarrhea and you will become sick. Where does that come from? That is actually an innate wisdom of the body. And the body doesn't want you to have that food. And so we actually have forgotten and gone out of tune with our body and mind connection. So it involves a little bit of work. Just going back to Dr. Bessel van der Kolk, he actually uses somatic therapy and he advocates yoga or Pilates and movement to actually stay in tune and retune body and mind together. So in summary, briefly, I just would like to end this with that hypnotherapy is not really magic, but actually it feels really magical when change happens from within. Thank you for listening. I'm sure you will have questions, and I'll do my best to answer them.
Thanks, Sunil. It was great. Some really fantastic information in there. Just while we're waiting for any questions to come through, do you want to tell everyone how they can book in with you if they'd like to do a session with you?
Yeah. Oh, okay. Thank you for that, Jackie. Yes, I forgot about that. The booking is I'm working through Lotus Holistic Medicine. And if you were to need, just ring the reception, or you can book through the hot doc. I would recommend that we book for a half an hour chat first, so that you can, it was a little bit of trust, obviously, and you have never seen me before. Plus, I need to know what problems we need to address so that we get a good blueprint first, and then we can work. Often I say 3 to 5 sessions, depending on how much work has been done in the past.
Sounds good. Thank you. Can everyone see in the webinar chat, I've just put the link to Hot Doc there if you'd like to book with Dr. Sunil. Does anyone have any questions? Did you want to pop them in the Q&A? If not, I've got a couple of questions if that's all right. I would love to know a little bit more about how NLP, and you also mentioned timeline therapy. How do they work in with hypnotherapy?
Oh, very good question, actually, Jackie. So timeline is, our body has got an innate way of measuring all those, mapping this out in 3 dimensions inside our mind's eye. For example, if I ask you to look at the future, most people look at the future either forward, most people, or slightly to the side, but usually forward. Very rarely people say my future is there. So timeline we use either inside the mind's eye, so it's elaborate visual imagination. But if people are not able to imagine that, then we can actually do in space, in reality, in 3D, in 2D, in the workplace. We draw out a line and say, mark a place as the present. And then the unconscious mind has got a way of putting it, like sometimes they put 1 year as just 1 pace away, and then 2 years or 10 years about 3 paces away. The mind has got this way, actually quite a fantastic way of mapping it out.
Yeah, it's interesting.
So, yeah, it's very good to go back and see ourselves how we did at that time emotionally.
And then how that's contributing to our current conditions.
Correct.
Yeah. Yes. Yeah, nice. I've just got one question that's come through in the chat. Can you do these sessions via Zoom?
The answer is yes. The session can be done via Zoom. Energetically, when people are sitting close by, there's a different feel to it. And a lot of people like to enjoy that experience because actually it's very relaxing. Interestingly, when we were doing hypnotherapy training, we really looked forward to hypnotizing each other because it was such a relaxing thing. And so it's almost people, when they get it, they feel really relaxed and happy. But yes, it can be done over Zoom. The only couple of things is you have to be distraction-free in a place where it is safe for you to sit comfortably and not be interrupted. Good internet connection, most likely having earphones or headphones, so that because the voice in hypnotherapy often is soft, so you can hear better. Yeah.
Great. Thanks for that. Yeah, that's good. Jenny has just asked, could being emotionally neglected throughout childhood be affecting my progress to heal in later life?
Unfortunately, yes. Yeah, emotional neglect. And I didn't touch upon abandonment and other aspects of this. As I said, developmental psychology is such a vast topic. I did not mention Dr. Dan Siegel is a child psychiatrist, and he has done a lot of work on this. And emotional neglect is a severe, significant barrier to healing. Because deep inside, if you look at the Maslow's triangle, the second step, which is safety, has not been met. So emotional neglect underpins the core of your personality. Unless we feel safe, we can't do anything in a comfortable way. So when emotional neglect, unfortunately, is a big barrier. Yes.
Yeah, absolutely. It completely primes the nervous system for later in life, doesn't it? It sets us off into being in a path of sympathetic or fight or flight activation later in life, and our nervous system recognizes the things that have happened in the past and brings that into what we are currently doing as well. So yeah, absolutely has a big impact. Next question from Conrad. Some people suffer a large number of traumas that each require attention. Can hypnotherapy work through each of these traumas separately? And if so, is the patient able to feel the difference once each situation has been dealt with?
The answer is yes. Conrad, Essentially, although each trauma has, it's our mind, the conscious mind that puts us in each compartment because they affect us in. So we talk about two things. One is called the Gestalt. So the Gestalt is a sum of multiple things is more than the equal. So for example, 2 + 2 is not 4. The Gestalt may be bigger than that. So what happens is often when we heal 2 or 3 core underlying values, for example, safety and trust, a lot of other factors automatically fall in. And suddenly you are, instead of getting, when you took 2, 3 steps up, suddenly you are right at the top. So it can happen. But the key would be to find out the core one first. And that takes a bit of experience and have a chat. More importantly, vulnerability. Often people withhold some information. Having said that, I must mention this. Actually, most of the work that I do and a lot of others, some of the workers in the trauma-informed hypnotherapists actually do is minimum content or no content. I don't want to know more details of that trauma that happened. Not because I don't want to know, because that will just is unpleasant for the person to revisit all the past. So basically, and the less you say, the better. As long as we say and in hypnosis, we can go back in time and see that emotional where that trigger started. And that time is enough. And at that time, we can look at what was the missing link there. And often we can heal that. Minimum content and multiple trauma situations, yes, but there will be often a pattern to those multiple traumas. That's the question.
Yeah, interesting. Thank you. Brooke is asking, so I'm currently working with Tara. I think that's Tara Hegarty, is it, Brooke? Doing energy healing. How are they different? And can you do hypnotherapy together with energy healing or just focus on one at a time?
No, actually, they could complement. I'm not an expert in energy healing, and see, we are energetic creatures, beings. So therefore, when we hold trauma, it is holding energy into your body, and various parts of our body and mind, of course, is influenced, and they influence each other. So when the mind is also lighter, because we have dealt with some of the deeper underpinnings of the trauma there, then what will happen is the energy will automatically become lighter. In fact, if you look at people who have actually transgressed all this and gone about that, you can see them. They're a bit more, there is spring in their feet. There is a bit of a smile on their face, a bit more relaxed appearance.
Nice, thank you. Next question. I've been reading Bradley Nelson's emotion code relating to releasing trapped emotions. Do you know that one, Dr. Sunil?
Unfortunately, I haven't read that book. I'm an avid reader. There are not many, I cover a lot of stuff, but unfortunately, I haven't read that book. So yeah, we'll take note of that.
Yeah, I haven't come across it either, actually. You'll have to add it to the list.
Yes.
Yeah. Can hypnotherapy be used for recent trauma, PTSD from a significant experience?
The answer is yes, but I say with a caveat. If the recent trauma is very recent, and if there is still ongoing processing required, then sometimes it may not be as effective because there may be some work to be done down the line. But we can probably mitigate and minimize the impact now. The other thing is sometimes recent traumas may have a secondary problem attached to that. And I'm sorry to say this, but the fact is, say, for example, if there is a trauma where there is a bit of insurance claim or something pending, and that kind of situation is, insurance lawyers want to see that this is an ongoing problem to be eligible for the claim. So there is a part of the mind doesn't want to heal because partly it is saying, if I heal, the payout will be lost. Sadly, the way the system works is such that it just gets dragged on for 12 months or more. And in that time frame, it is not that easy to heal unless you decide to just leave the insurance claim. And I had experience from a couple of 2-3 patients. In fact, currently I have a young lady having a DVA claim, and although she wants to move on, she's just afraid that her claim may be rejected if she gets better, although that's a very sad situation.
Yeah, absolutely. So how long after a traumatic event would be ideal for hypnotherapy? Thinking there's no insurance claim or whatever going on.
Yeah, that I do not actually, to be honest, I haven't come across, I have personally not dealt with that situation. Nobody has come to me saying that recently something happened. If the person is willing to just relax and let go, because all these experiences from a higher perspective is actually a learning experience, although at that time it is traumatic. It is if you want to believe that the higher force of the universe there is some insight there about us there, how we deal with a traumatic situation. And in that situation, what we learn about ourselves is what is the learning there. So sometimes we need to have the willingness to let go of all other judgments and be open to that vulnerability and inquiry into what is this doing to me right now. So it depends on the person. So unless we have an individual, like a case-based discussion, hard to give a real answer to that.
Yeah, no worries. That's fine. Thank you. Benita is asking, if your memory is poor, including of your childhood, how does that work with hypnotherapy? Do you just start naturally remembering things?
Very interesting question. Thank you. Dr. Bessel van der Kolk and Dr. Gabor-Mate, both of them have commented on this. Actually, the memory gaps is a way of protecting ourselves. The reason is our mind does not want to remember the painful memories. So some of that is but the trauma is still stored in the body. And so what happens is some of our behavior patterns are because of that trauma, however, we do not consciously remember that. In some ways, it is protecting us, but in hypnosis, we actually do not look at the memory itself. As I said, I'm a minimum content. We are only looking at the emotions. And the emotions often, I use another technique called the hummingbird method, where we look at, because unconscious mind talks and understands things better in images and metaphors. So your body, your mind, unconscious mind will come up with a metaphor that will describe the trauma, although you may not remember the trauma. And therefore, we can use that to heal.
Great, good answer. Thank you. Brooke's just asking, how is hypnotherapy different to energy healing, or how similar are they?
Energy healing uses energy meridians and energy planes. And in the Indian system, in the yoga system, we call the chakras. And in some of the Western system, there are layers of energy. So it is a different rule where hypnotherapy does not access that. So hypnotherapy is more mind-based, subconscious mind and unconscious mind and the conscious mind. And our relationship to time and the events. So that's what hypnotherapy would use. Energy would not, but once we heal, energetically, we are different, if that makes sense.
Yeah, great answer. I hope that answers that, Brooke. Thank you for the question. Next question. We've just got a few more to go. Sunil,
Yes, okay.
why is it that trauma is not explored as a root cause when a patient presents with an acute mental health challenge? That's a good question, isn't it?
It's a very good question. Really sorry. I have to say, as doctors, the whole health profession, we lost connection with our core self, unfortunately. We became more scientific and left brain oriented, more logical. And so whatever that doesn't fit into that pattern of thinking, we automatically discard as woo or not. And I think it is very sad that has happened. But that is the reason when you go there, we always look at the biopsychological and biosocial model. In fact, not social, biopsychological model. So therefore, what happens is we only try to, so anybody who has got acute, we will name them acute stress reaction or acute mania and so on and so forth. We rarely put them as something that could be deeper. Interestingly, on that topic, I would like to just illustrate a certain point. I was in one of the talks, conferences I attended, one speaker was giving this anecdote, and I really think that explains a lot. When Princess Diana died in a car crash in the UK, I still remember, we used to live in the UK at that time, and I still remember exactly what I was doing at that time. And pretty much a lot of people were in tears outside with flowers, and the Buckingham Palace area, the flower was such a hill of flowers. And psychologists subsequently went in and had analyzed the situation, and they came up with the fact that people actually had hidden fears and reasons to be sad and crying. And that opportunity that gave them a permission to do that. And so the acute trauma response is actually, in a way, an outburst of our feelings we convey when we get the right moment. But a lot of psychiatrists and emergency physicians are not trained to look at this that way. So therefore, they will put the easy path, which is give some more tablets, either Valium or some sedation, and try to heal from that.
Absolutely. I hope that starts to change over the coming years, but we'll see what happens. Yeah, absolutely. Next question, if you're wanting to book specifically for hypnotherapy, do you just select as a new patient consult? Yeah, so Dr. Sunil is really only doing mind work at Lotus. So yeah, just select the new patient consult.
Yes, thank you.
Yeah, that's great. Thank you. Last question, Monica has asked, what if you don't know the source of the trauma, but have anger and resentment that you know comes from somewhere?
Yeah, great question. But anger, again, as earlier on I mentioned about where the trauma, we don't need to know, but anger and frustration is almost 100% coming from somewhere deep inside. And it could be unexpressed fear or that is masquerading as anger. Anger, it could be sometimes directly at oneself. And so the best way, we don't need to know where exactly or how long ago what happened. But interestingly, most of these things have happened in our childhood when we were less than 8 years old. Because most experts say all our coping strategies and our growth in that sense is already in place by the time we are 8 years old. And then we are able to rationalize things and hide things and mask things or explain it away, which is why we continue to struggle. And so, yes, we don't need to know, but the only thing is a sense of openness and a sense of curiosity. Why am I being angry? And come for the session with that viewpoint, with an open mind, with no real expectation other than wanting to get a resolution to this.
Yeah, great answer. Often the body will block out what the trauma is anyway, right?
Correct,
yeah. Jenny just says, thank you, Dr. Sunil. That talk was so enlightening and we don't have any more questions. That was great. I really enjoyed that. Thank you. And right on time. Thanks everyone for attending. Really appreciate that. And yeah, just a reminder, there's the hot doc link there in the chat if anyone wants to book with Dr. Sunil, or just give reception a call and they can answer any questions as well. So our reception at Lotus Holistic Medicine. And if there's no more questions, then thank you again and we'll see you next month for our next webinar. Thanks, Dr. Sunil.
Thank you. Safe travels, everyone. Bye-bye.
Bye, everyone.